Oh, kia ora. My name is Sarah Georgeson. I'm a policy analyst with the New Zealand Disability Support Network. Our question is, a key challenge for the disability sector is workforce planning and development. What measures would you and your party initiate to help the sector recruit and retain good staff and encourage workers to further develop their skills and see a career in disability support services as being of high value to society?
Thank you, Sarah. We'll start at the end with Ariana, please.
Kia ora, a fellow lover of the Bay. Nice to see you. So yes, we need to ensure that disabled people receive the support they want in the places they want in a culturally appropriate manner. So we need to ensure that health and disability and service staff are properly trained and provided with ongoing professional development to ensure that cultural competencies and competencies are actually audited. So we'd continue with that. We need to make a fair payment for support workers, including making NGO staff rates comparable with DHB staff rates and payment for travelling time. And so we need to also ensure that disabled people in whānau are involved in developed ways to monitor quality and performance of health and social services. Kia ora.
Thank you, Paul.
So just to make sure I understand the question, you're talking about people working in the sector or vocational opportunities for the disabled?
Workforce development.
Workforce development, okay. Well, on the vocational opportunities, we put $6 million there, but one thing we have done in particular is looking at providing assurance around vetting, to make sure that people are actually safe to work in that sector, along with those who work with children as well. We want to make sure that that people are absolutely safe, and we have as a government, we don't have any background that would suggest that that person shouldn't be working in that sector. So that's one thing we've done. There are probably other examples, but once again, I have to concede I'm not necessarily fully across them.
Thank you. Chris?
Thank you for the question. I mentioned earlier that I used to be our aged care spokesperson, and I think we basically have to do the same thing in disabilities as we have to do in aged care. And that is, first of all, we need to make sure our workers are getting paid a decent wage. They're all very much minimum wage workers at the moment, and if we're going to value them, we need to pay them a decent living wage. The next thing we need to do is make sure that there's training there, because of the issues that are similar to aged care are there with disabilities as well. It's physical work, it's demanding work, and you also need to have a fair bit of medical knowledge to be able to deal with people with disabilities. So we need to have a career path for people to see that there's a decent wage at the end of it, and there'll also be some professional development along the way. And also you need to make sure there's some minimum standards in terms of where people with disabilities are and where people are working. But I think the most important thing is we have got to pay the people who look after people with disabilities a decent wage. If you don't have an aspiration to work in the industry because you're going to get paid a decent salary, then people aren't going to work in that industry.
Thank you. Hugh?
Well, New Zealand First has about 40 policies here for improving the lot of people with disabilities. So I'm sure that we have to have some adequate funding and planning for workforce development. I think it's not such a sexy thing that it was actually included in one of our policies, but it does follow naturally, doesn't it? Thanks.
Thank you. Mojo?
The short answer is yes, and the longer answer is we're committed to increasing the minimum wage. We're committed to the living wage for all contracts and public sector things, so that includes contracts to service providers. So we would expect service providers to provide at start with the living wage. And we would also want to write into contracts that acknowledge things like cost of living adjustment, career pathways and so on, so that all of strengthen and work in partnership with service providers rather than having a kind of top-down contract organisation approach.